Hello everyone. Today we will discuss one of the important high yield topic for NEET PG exam in pharmacology, and that is Matzke method for aminoglycoside. So let us discuss about the Matzke method in today's video. Matzke Nomogram, it is one of the important clinical scale and it is the pharmacokinetic approach used for aminoglycoside dosing. And the aminoglycoside drug that is used for Matzke Nomogram is vancomycin. To determine the dosing of the aminoglycoside, you will need patient's age, body weight, serum creatinine, and creatinine clearance. Matzke nomogram, patient-specific pharmacokinetic information, and based on the renal function, you can decide the aminoglycoside therapy for individual patient. Now, vancomycin that is being eliminated by the kidney, and if the renal function deteriorates, then the vancomycin elimination also decreases, and that means the drug is going to accumulate more in the body, and so you have to increase the dosing interval for the vancomycin. So in case of deteriorated renal function, you have to increase the dosing interval for vancomycin. So this is the Matzke nomogram, and to assess the renal function, we will measure creatinine clearance in ml per minute, and based on the vancomycin dosing regimen, we will decide the dosing interval for the individual patient. So this is the therapeutic drug monitoring for vancomycin dosing. So this Matzke nomogram may not be suitable in case of the peritoneal dialysis patients. Now current vancomycin therapeutic drug monitoring is guided by AUC upon MIC, and this is 400 to 600. Now in cases of serious MRSA infection, MIC is assumed to be 1 milligram per liter. So this is the AUC guided dosing for vancomycin, and the target is usually expressed as AUC upon MIC 400 to 600. Now let us discuss MCQ. A 68-year-old man with the MRSA bacteremia started on IV vancomycin. His estimated creatinine clearance is 30 ml per minute. The physician uses Matzke nomogram. What is the primary purpose of this nomogram? Calculate the loading dose of vancomycin, determine the dosing interval according to renal function, predict nephrotoxicity, decide whether vancomycin should be discontinued. As we have already discussed, Matzke nomogram, the answer here is a determine the dosing interval according to renal function. A patient receiving aminoglycoside therapy has two serum concentration obtained at a known times after a dose. These data are used along with the patient's pharmacokinetic parameters to individualize the dose and dosing interval. Which approach best describes this strategy? Rumac-Matthew nomogram, Hartford nomogram, Matzke nomogram, and Prescott nomogram. Here it is for aminoglycoside. So the nomogram that is used is Matzke nomogram. Rumac-Matthew is for the paracetamol poisoning. Hartford is for the aminoglycoside. But in that, you don't use this type of the pharmacokinetic parameters. Prescott nomogram, this is for the salicylate poisoning. So correct answer here is a Matzke nomogram. So let us revise about the Matzke nomogram in today's video. Matzke nomogram is used for individualized aminoglycoside dosing based on the pharmacokinetic factors, especially renal function, and that is calculated with the help of the creatinine clearance. So for vancomycin, if there is a reduced renal function, then the clearance also decreases, half-life of the vancomycin will increase, and that will result in accumulation of the vancomycin inside the body, and that will ultimately result in increased dosing interval. So this is used only for the altered renal function in case of the vancomycin. And the other way of therapeutic drug monitoring for vancomycin is AUC upon MIC, and the target is 400 to 600. So if you like this video about the Matzke nomogram, then subscribe to my channel and follow for more such pharmacology related videos. Thank you.